Welcome to the deep dive. Today, we're jumping into a topic that, well, it definitely gets people talking. Contraceptives, good, bad. You hear so many different things, but let's get one thing clear right up front. These are pharmaceuticals, like antibiotics or chemotherapy. They're powerful medications. So this deep dive isn't about judging, it's really about understanding.
Exactly, and that's such a key point. Like any potent medication, contraceptives have real clinical benefits, therapeutic uses, but also, yes, potential side effects. So the main thing we want you to take away today is that knowledge really is power here, whether you're making choices for yourself or you're a clinician or maybe a nutritionist. Understanding how they work, the benefits, the risks, the alternatives that empowers you. So this deep dive is really for you to get that power, that clarity.
Okay, let's unpack this then. Most people hear contraceptives and immediately think, okay, preventing pregnancy, that's the big one.
Yeah.
But how do they actually work inside the body? Beyond just that, what's the basic mechanism?
Right. So fundamentally, most of them are made up of synthetic versions of female hormones, usually estrogen and progesterone together, though some newer ones are progesterone only. And their main job, sort of the clever part, is they mimic your natural hormonal cycle, but in a way that stops you from ovulating. Normally, you'd release an egg around, day 11 to 14 of your cycle.
So these external hormones kind of fake the body out, make it think ovulation already happened.
Pretty much, yeah. They do this by essentially hitting pause on your body's natural hormone control center. It's called the hypothalamic pituitary ovarian axis. Bit of a mouthful, but think of it as the communication line between your brain and your ovaries. Contraceptives basically tell your brain to stop sending out the key signal hormones. Those are LH and FSH. And without those signals, your ovaries don't gear up to produce their own estrogen and progesterone, and crucially, they don't release a follicle. No egg gets released.
Wow, okay, so it really shuts down that whole natural process. Is that the only way they work for pregnancy prevention?
Well, it's the main way, but not entirely. It's kind of a two-pronged thing. Besides stopping ovulation, these synthetic hormones also change the lining of the uterus, the endometrium. They make it much harder for a fertilized egg if one somehow did get released and fertilized, which is rare, but they make it harder for it to implant and start growing. So yeah, that combination makes them very effective for preventing pregnancy. And like you said, that was the original goal, used by millions for, over 60 years now.
Right, and this is where it got really interesting for me when we were prepping for this, because yeah, pregnancy prevention is huge, life-changing for many, but I was genuinely surprised by the other clinical uses. They're not just for birth control, are they? Can you dive into some of those? Because this part is fascinating.
Absolutely. And it's important because while sometimes maybe they're reached for a bit too quickly, they do have really valid therapeutic roles. It's a bit like, say, using an antidepressant during a period of intense stress. It can be crucial, but ideally, it's part of a bigger plan addressing the underlying stress, right? So, okay, specific uses. A big one is polycystic ovary syndrome, or PCOS. Now, many people know PCOS is often linked with insulin resistance, maybe high insulin levels, hyperinsulinemia. So the first-line treatments usually focus on that: nutrition, strength training, maybe metformin, addressing the metabolic side.
But I'm guessing sometimes that's not enough, or the symptoms are just really severe.
Exactly. You see women, sometimes quite young, maybe 16, 17, but also women in their 20s, 30s, dealing with severe hyperandrogenism. That's too much testosterone, basically. And it can cause really stubborn, difficult problems like acne that just won't clear, even with strong stuff like Accutane or antibiotics.
Yeah.
Or significant hair loss, or hirsutism, that's excess body hair, sometimes so much that even laser hair removal doesn't fully work. And the impact on self-esteem, especially for young women, can be just devastating. So in those situations, contraceptives can act as anti-androgens. They lower testosterone and increase something called SHBG. SHBG is sex hormone binding globulin. It basically grabs onto free testosterone in your blood and makes it inactive. So symptoms improve. We might use them for, say, 6 months, maybe up to a year. It's like applying a patch. It gives relief from those really tough symptoms, helps with confidence, and this is key, while the person is also working on the root causes, the nutrition, the exercise, maybe supplements like myo-inositol.
That patch idea is really powerful. Using the medicine strategically for relief, but not stopping there. Tackling the why at the same time. Okay, so beyond PCOS and those androgen symptoms, where else are they a critical tool?
Another really important area is amenorrhea, basically, when periods stop completely. This can happen for different reasons. Could be related to eating disorders, or maybe very intense athletic training, or even just high levels of chronic stress. The last one is often called hypothalamic amenorrhea. And the worry there isn't just, oh, no period, it's the lack of hormones.
Right. So if someone's period stops because of, say, intense stress or training, what's the actual danger long term?
Yeah, great question. If estrogen and progesterone levels are really low, undetectable even, it puts that young woman, could be 19, 20 years old, at risk for things like osteoporosis later on, increased fracture risk, even depression, problems with ligaments. It's like inducing menopause decades too early. So in these cases, contraceptives supply that external estrogen and progesterone. They mimic a cycle, protect bone health, protect against those long-term risks, while, again, the work is being done to address the root cause of the amenorrhea, whether it's nutritional support, stress management, adjusting training, whatever it is. It's about protecting her future. Then there's also progesterone deficiency. Sometimes women ovulate okay, have enough estrogen, but they just don't produce enough progesterone in the second half of their cycle. This can be linked to, again, severe stress, sometimes gut issues like SIBO, small intestinal bacterial overgrowth, or just chronically high cortisol levels. And that imbalance can lead to irregular periods, often problematic ones, maybe heavy, maybe unpredictable. So while you're sorting out the stress or the gut health, using contraceptives, or sometimes even just progesterone for the last 14 days of the cycle, can help regulate things and make the cycle healthier.
Okay, so regulating cycles, protecting future health, correcting imbalances, it's way more than just birth control.
Yeah.
Any other major conditions where they play a role?
Definitely. With endometriosis, for instance, contraceptives are often used there to help manage hyperestrogenism, too much estrogen, which is a big driver of the inflammation and pain in endo. They can also be really helpful for women with severe PMS or the more extreme form, premenstrual dysphoric disorder, PMDD. PMDD is serious. It's actually a psychiatric diagnosis. You can have like 2 weeks of intense depression, anxiety, mood swings before your period hits. It's debilitating. Contraceptives, by stabilizing hormones, can sometimes really help manage those severe mood issues. And one more cases of abnormal bleeding or anemia. Think about women bleeding really heavily, maybe every 2 weeks, or dealing with fibroids causing heavy bleeding. This can easily lead to chronic anemia, and that means exhaustion, difficulty concentrating, huge impact on quality of life. Imagine being a student facing exams or an athlete trying to perform. Contraceptives can regulate the cycle, reduce that blood loss, prevent the anemia. And again, that patching idea comes in. Why suffer like that for months when medication can offer relief while you investigate and treat the fibroids or whatever the underlying cause is? It provides breathing room.
Wow. Okay, it's really clear they're incredibly versatile tools, offering relief, protection, tackling some really serious conditions. But like anything powerful, there have to be risks, right? Things people absolutely need to know about. It's not a simple take this pill and everything's fine situation, is it?
Not at all. And understanding these potential downsides is just as crucial. One of the big ones is an increased risk of blood clots. Doctors call it hypercoagulability. Basically, your blood gets a bit stickier, more prone to clotting. Now, this risk is higher, significantly higher for certain groups. Women over 35 who smoke, definitely. Also those with high blood pressure or abnormal cholesterol levels, or who are significantly overweight. But even younger women, maybe late 20s, if they have some of those risk factors, need to be aware and have that conversation with their doctor. It's mainly the synthetic estrogens that can affect clotting factors.
That's definitely serious. Good to know the specific risk factors. What else should be on the radar?
Another consideration is a potential increased predisposition to certain estrogen-dependent tumors. So if there's a strong family history of cancers that feed on estrogen, like some breast cancers, ovarian, uterine cancers, then adding external artificial estrogens might nudge that predisposition slightly higher, even at a young age. It really highlights why knowing your family history and having a thorough discussion with your doctor is so important before starting. Okay, now here's something really crucial, and it sounds a bit paradoxical. When you're on the contraceptive, especially certain types, maybe those with a progestin called medroxyprogesterone, you might see really good improvement in those androgen symptoms we talked about. Skin clears up, hair seems thicker, you feel better about how you look. However, and this is the twist, some contraceptives can actually quietly make peripheral insulin resistance worse.
Whoa, hang on. That sounds counterintuitive. You're saying someone could look and feel better on the outside, clear skin, regular cycle, all that. But underneath, a core metabolic issue like insulin resistance could actually be getting worse. How does that work? And would you even know?
It's a really critical point, yeah. Physiologically, some of those synthetic progestins can interfere with how your cells use glucose. They become less sensitive to insulin. So your pancreas has to pump out more insulin to do the same job of managing blood sugar. You might not feel it directly while on the pill. The problem really shows up, often quite dramatically, when you stop taking it. Maybe 3-6 months later, bam, those androgen symptoms, the acne, the hair loss, maybe oily skin or scalp, they can come roaring back, sometimes even worse than before you started.
Oh, wow. So it sets up this kind of trap. You feel okay on it, you stop, you feel awful. So the logical thought is, oh my gosh, I need
Yeah.
this pill. But really, the pill was masking and maybe even worsening the underlying metabolic problem. That really makes you question, are we fixing it or just delaying a potentially bigger issue?
Exactly. That rebound effect often leads straight to that conclusion. I can't live without it. When the actual issue is that the underlying insulin sensitivity, the metabolism, wasn't addressed while the symptoms were masked. That's what we mean by the insulin resistance paradox. And it's exactly why that patching idea only works if you use that symptom-free window to really double down on the foundational lifestyle work. And then there's the last point, the potential long-term impact on fertility after using them for a really long time. Imagine someone takes contraceptives for, say, 10, 15 years straight. Maybe they started young for acne or irregular periods, then stayed on for birth control, then at 33, 34, they decide they want to try for a family. Well, that hormonal axis, the brain-ovary connection, has been suppressed for a very long time. It might not just spring back into action immediately. They might need time to sort of wake up. This can mean ovulation is irregular, maybe only happening every couple of months, or the quality of the follicles, the eggs themselves, might not be optimal initially.
So even if technically the egg count, the ovarian reserve, is still okay, the whole system might be sluggish or out of sync after being off for so long.
Precisely. And we also sometimes see PCOS symptoms come back with a vengeance, or even show up for the first time if they were masked before. So you can end up in a situation where, despite having a decent egg reserve, conceiving is difficult. Sometimes it leads to needing fertility treatments, like IVF, especially if that underlying PCOS was masked since they were a teenager. The body's natural rhythm needs support to get going again after such a long pause.
Okay, this is just incredibly nuanced, so much to consider. It's definitely not black and white. It really underscores the need for a very personal approach. These are powerful meds, clearly. Huge benefits in the right context, but also really significant things to watch out for. So how do people navigate this? If you're facing some of these issues, what does that integrated path forward actually look like in practice?
Yeah, and if we tie it all together, that's what integrative medicine is really about. Using pharmaceuticals when necessary, absolutely, but always aiming to do it alongside addressing the root causes, supporting the body's own systems and natural balance. It's about building true long-term health resilience.
Okay, so practically speaking, if someone's using a contraceptive for PCOS or maybe progesterone deficiency, what can they do while they're on it to work towards fixing the underlying issue?
Great question. The foundation always is lifestyle. You really can't overstate this. Optimal nutrition is key. Focusing on whole foods, good quality proteins and fats, stable blood sugar, correct eating habits, fundamental. And strength exercise. Hugely effective for improving insulin sensitivity. That's massive for PCOS, but helpful for overall hormonal balance too. These two things alone can make a huge difference metabolically. Then beyond that foundation, we can use targeted supplements or active compounds. For example, myo-inositol. There's a lot of good evidence for it. It's often described as one of the best things for improving insulin resistance, especially in women with PCOS and hyperandrogenism. It helps the cells listen to insulin better.
Okay. And what about for something like low progesterone? Are there natural supports for that side of things?
Yes, absolutely. To encourage the body's own progesterone production, things like Vitex, which is also called chasteberry, or sometimes saw palmetto, can be helpful. They seem to work partly by nudging the pituitary gland in the brain to send out more balanced signals. And if the issue is more about managing excess estrogen, like in endometriosis, broccoli extracts, things like DIM or I3C, can be really useful. They support the liver in processing and clearing out estrogen more effectively. So the key message here, the ideal strategy really, is if you were taking contraceptives for a specific health problem, start working on this whole toolkit, the nutrition, the exercise, the targeted supplements right from the beginning. Use that time the medication gives you. The goal of this integrated approach is to eventually be able to stop the contraceptive, hopefully without the original problem coming back, or at least having it be much, much more manageable. It's about empowering your body for the long run, not just covering symptoms indefinitely.
Wow. What a deep dive that was. We've really looked at contraceptives from so many angles, seeing them as powerful medicines, yes, with crucial clinical roles, offering real help for tough conditions, but also seeing the other side, the risks, that tricky insulin resistance paradox, the rebound potential if we don't dig deeper than just symptom control. It really hammers home that being fully informed, understanding the whole picture, is where the real power lies.
Absolutely. That's the essence of integrated care. It's not just about treating what's on the surface. It's about understanding why it's happening,
Yeah.
nurturing the body, helping it resolve the underlying issues, using all the tools we have, whether that's a medication for a time, a lifestyle overhaul, specific nutrients, using them wisely, asking why, not just what.
So, as you're thinking about this whole idea of patching symptoms versus getting to the root cause, here's something to chew on. Where else in your life might you be using a temporary fix, a patch, instead of really investigating and addressing the fundamental issue? How could you maybe apply this more integrated, holistic way of thinking to other parts of your health, maybe even your work or just your general well being? Something to think about.